please, once you've read the first one, please tell. I'll change slide.
Okay.
Once you'll say, we'll change the slide.
Yes, okay.
Okay.
Next slide.
Yes.
Okay, now you can shift to the first slide.
Yes.
Okay.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hello.
Yes, hello.
I'm Dr. Ali Bade. I'm Dr. Ali Bade, ST3 doctor working for Mr. Mann in the Manchester Hospital. I'm calling to speak to the cardiothoracic surgeon. Can I check that I'm speaking to the cardiothoracic surgeon?
Yes, Dr. Ali, go ahead. I'm the
Yeah,
cardiothoracic.
I'm calling you regarding a trauma patients. He have widening mediastinum on chest X-ray, and I'm worried that this patient has having aortic injury, and he is hemodynamically unstable.
Oh, it seems that your patient is very interesting. Can you please tell me more about your patient?
Yes, this is 23-year-old motorcyclist. Is come today to the AR, and he complained of chest pain, and on my assessment, his GCS is 14. His blood pressure is hypotensive, and on examinations, the left side is swollen, no open wounds, and on investigation, there is hemoglobin is normals, and arterial blood gas is showing there is acidosis. And on imaging, chest X-ray showing widening mediastinum, and abdominal X-ray show shadow, south shadow, it's not seen. And left femur X-ray show that there is shaft fractures. and the chest tube inserted inside in the right side. Based on this, I'm calling you to refer these patients for further assessment and interventions and immediate interventions.
All right. Before, yes, first, let's do, ask you some questions. What you will do for the cervical spine?
Yes, as I will make decision according to the ATLS in airway, I will stabilize airway and stabilizing the cervical spines with semi-rigid collars, tape, and sandy back.
Okay, that's good. And do you think this patient, according to his vital, he is shocked?
Yes, due to he has tachycardia and hypotensive.
Okay, and so what you will suspect the type of shock in this patient?
This may be hemorrhagic shock, and also it could be cardiogenic shock or obstructive shock.
Okay, and what is the source of bleeding in this patient that will make him hypovolemic?
Yes, maybe this injury to the great vessels in the mediastinums or inside in the abdomens or in the side.
All right, and what you will do for the thigh?
I will immobilize the thigh with some splint.
Okay, so what is the more urgent now?
Yes, this patient in the X-ray has widening mediastinums and patient hemodynamically unstable. This is worry. I'm worried about there is injury to the great vessels.
Okay, I can see. And then what will you do for the blood pressure?
For now, I will resuscitate patients by giving him IV crystalloid. I will take blood for cross-matchings, preparing of blood.
How much crystalloid you will do, and what is your target blood pressure?
Yes, I will keep the systolic pressures less than 100, permissive hypotensive to not increase the hemorrhage.
Okay, okay. And yes, you told me there is tell me what is the blood abnormalities in your patient?
The hemoglobin is there is acidosis because a
All right.
patient in shock.
Yes.
And
other.
and
Okay, and patient also is diabetic.
Okay, and what about the hemoglobin?
Hemoglobin is normal.
Mhm.
Hemoglobin is 8 milligram, 8 gram.
Yes. Yes. Okay. So what do you think the cause of acidosis in this patient?
This is due to the shock leading to the anaerobic glycolysis, producing more lactate.
All right. And then any other
Yes.
cause?
and hemorrhagic
Okay, this
shock.
may be due this patient diabetics, also maybe diabetic ketoacidosis, or this patient have fractures, may he develop compartment syndrome.
Okay. So what additional investigation you'll do?
I need to rule out cardiac tamponade and cardiac cause by doing ECG and echocardiogram for the heart, and also I need to do CT scan for the abdomen.
All right. And do you need to do CT for the brain?
Also, yes, because patients the GCS it was less than 15. I need to exclude the extradural hematoma or any intracranial hemorrhage.
Okay. So can you please tell me more about the abdomen of this patient?
Yes, the abdomen, it is yes, in
Yes.
X-ray there is a dilated loop showing in the X-ray. So I expect there is intraperitoneal fluid or hemorrhage, and this patient may need consultation from the general surgeon.
Okay. And this absence was scheduled. Yes.
Yes.
What are the yes if I ask you to send the patient, who will accompany the case?
Yes, I will come with the patient with the one of my colleague from the anesthesia team.
All right. And so why do you refer this patient?
Yes, these patients need urgent, need emergent surgical, need interventions for this great vessel injury.
Okay. And yes, so what is your differential diagnosis for this widened mediastinum? What could be?
This is traumatic aortic injury, also maybe cardiac tamponade.
Okay. And what
Good.
will you prepare in the ambulance?
Yes, oxygen for the patient, IV fluid, blood, cross-matched blood, and also CPR set, communication technology.
Okay. And if this patient need intubation, who will do?
By expert anesthetist.
All right. And could you please tell me if you suspect major vessel injury, why the chest tube is less draining, not draining more?
Yes, because the chest tube is in the pleural space and the bleeding from the great vessels inside the mediastinum.
Could you please tell me what is the definitive management you think for aortic injury?
Yes, this patient need surgical repair or endovascular repair.
So in this traumatic aortic injury, what do you think the site, the part usually injured?
This is descending aorta because it is fixed.
So if a widened mediastinum due to cardiac tamponade, what is the treatment you think?
This patient need thoracotomy. If it's not available, if it's not possible, I will go for pre-cardiocentesis.
Good.
Okay, thank you very much. You can send the patient now.
Okay,
Good.
thank you.
Thank you.
Okay, yes.